kind of really hands-on. You know, you want to do something with population-based data. And you might have heard of SHIP, potentially via the NFDI Central Study Hub. And now, how do you get to the data? This is what I'm going to answer in this session. And for this purpose, I'm going to share right now my screen. Just have to put this here. Okay. So you might have heard of then the site that we offer. There, we have a website with a web application behind, FAIRequest, to obtain access to our data. And this is what you see in here. And I will briefly go over the key elements of this description, as this is what you will be walking through when applying for our data. First of all, it might be interesting to say, now, is this something very novel? How used is what I am presenting? And actually, it is very used. It is one of the most widely used access portals in Germany, in Europe, and I think for epidemiologic studies worldwide even. So we have easily more than 100 applications per year for a long time right now. And all this is working only because we have a highly formalized workflow. And that is what I'm going to illustrate. Okay, let's go back to this. Now, when you think about our data, you might, of this population study, it's kind of what is in the box. For this purpose, we do have, I just struck a little bit with the bar in the top with meeting aufzeigen. I see it here, okay. That you might want to get a description, and everything that is in here has a description. By the way, our transfer portal is not only for the study of health in Pomerania, it may host any number of studies. So it is right now 3 studies in the University of Medicine Greifswald, but the study of health in Pomerania is the workhorse. So through this, you get access to the to papers on the study. And for instance, you go follow the link and then you arrive at some paper. And one way to revise is simply to look what is in the paper. You see, okay, data collection has started in 1997. It is what is described here to the early 20s. It is still actually ongoing. So these are the core data bodies that are currently used for data applications. They are in here. And also in this paper, you see what is approximately in the box. So this is kind of to get an overview. You can simply follow the link and see what's in there. That is nice, but of course, it can be nicer. And for this purpose, I just show what is openly available. Well, we have data overviews that are publicly accessible. Depending on how you approach it, that's not the single best way. You might either, for the single examination wave, simply want to see in kind of a document what is there. So we have the data dictionary in a PDF format in here, and you just can revise it. For some purposes, this is quite convenient. And then you have the data overview, which is kind of another view on the data dictionary where all the data bodies are in. And in here, you see a hierarchically ordered what is within the single examination waves. For instance, this is one of the examinations, and you see there's a tremendous scope of data in the box. With all sorts of approaches to collect data. And if you go further down, medical examinations, you have more. If you go to physical examinations, you have more. And then, for instance, you get an overview on somatometry, and you see what are the variables you could apply. So this is a way to get an overview. And as you obviously see right now, this is very complex. And you could spend a lot of time looking. This is why since last year, in cooperation with Maelstrom, we have a taxonomy in place to kind of have an idea. For instance, let's say you are interested in tobacco use as a predictor. So what do we have with tobacco use? You click on tobacco in here, say, okay. Then you have to close tree and go in once more to SHIP trend 0. You see, okay, tobacco related content has been collected as part of the personal interview, and it is actually these questions that have been made. And the same thing, you can repeat this for any other entry. So this is kind of, it informs you on a certain topic. What is it we have in the box to orient yourself? Are you approximately able to get out what you need? Now, let's assume you kind of did this and decided, okay, that's kind of cool. I would like to work with SHIP data as many others did. It's just to give an idea. There are about, by now, I would say a little more than 1,800 peer-reviewed publications based on the SHIP study. So we have 2 to 3 papers per week with a mean impact factor currently of 9. And one major enabler simply has been this process. So what would happen then? Well, you would simply register. There is a simple page for it. I will not go through it's just, well, you enter your contact details and there is no big fuss to it. So you just register basically and you can enter. So you enter with this, the internal part of our website. And now in here, you are able to create data applications. So what does this mean? Let's assume you say, okay, I have an idea. I want to do this. You click on new, I'll just go to English, create a new application. And then this is the demo overview. I give it this title because it's easier to then delete it afterwards. So then it's a first application and you create this. And then the common thing is you just want to use the data that is in. There is also a possibility to apply for instance, for images to generate data. But this is, well, let's say you want to use data. You say which data you want to use, for instance, SHIP trend. I set the symbol here, and then I save it. And then I'm in the formal overview of the application. And with this, I will go only over what is in our application. So there are some automatically filled in fields. And then you assign new participants. Those participants are only registered persons in our transfer site. You define when to conduct this. And then you submit a project description with an abstract, a scientific background, hypothesis if they are information on certain methodological aspects, on possible conclusions. We added right now as part of another project that how is sex taken into account? And if you apply for material, you need to tell exactly what you need, which amount. This goes through an extra review process. And then you specify the data, you do the data selection. And here we are back again. I just go to the place where I have been before. And let's go again to medical examinations and physical examinations. And here we have again somatometry, and you see again the list. And if you click on this on the top left part, you get further information on those measurements. For time reasons, I will not go into this. And now you have 3 categories. This is unique. I'm not aware of any other place where this is conducted this way. And then you say, for instance, okay, I need certain variables because I want to use them as predictors. So they are kind of an exposition. I put them in this category in here. And then I might have mortality as an outcome. So I would go to some other part where, for instance, so where do I have it? Or let's say which outcome. No, I take a morbidity follow-up. Let's say I take this. And then, not a small, no, let's go here. Wait a second, mortality, here it is. And then, for instance, I could say, okay, I want to predict certain mortality aspects. So I select them, and this is the way you go through it. You apply for your data, you select the data, and at some point you are finished and you go back to the overview, and it's kind of a shopping basket that you've created with those variables in. And what is so cool about this, instead of just having a list of variables, you can a lot of times see whoever applies for data, does it make any sense at all what this person is doing? You cannot tell it from a single list. This is something where frequently it gets turned back. We say, it makes no sense what you apply for. Please put in some logics. And it's especially beginners who really fail on this. But that is intended, so it's an advantage. Okay, so then you provide if there is something specific on the variables or on other informations, and then you kind of agree. Well, and this is the question, you agree to something and then you submit this application. You might think about what are you agreeing to, and I go back to the home overview, and this is in downloads. We have certain contracts, rules for data to be passed on, so you can just revise it. It's here now in German. We have a standard contract, which we almost never alter. Sometimes some improvement is seen, but regularly this is just, well, take it or leave it, because we don't take money for it. But we also have, in a way, you also pay for this. For instance, if you generate new data, it is our data in the end. And we can do with it what we want. And there is no way to intervene for others on our future decisions. They have a preliminary primary right to use it, but once this period is over, we are free to do anything we want apart from commercial use. So you might want to revise these contents to see, do I really want to cooperate with them? And what is happening next? I will just show one more slide. This is what you've seen. So once you have set up the application, it is passed on to the transfer unit. And again, there is another internal web application, which I'm not showing right now, which is to handle all the applications, the stages, and who is involved. And the first thing is it gets passed on to a board meeting. And in there, based on certain criteria, kind of, is it scientifically sound? Is it interfering with other projects that are already ongoing? We try to avoid any interferences. And then there's something else. We don't just send data out in the world. So commonly, we require that there is a cooperation with someone from the University of Medicine, and we make sure that depending on the data that is touched, those who really work to generate the data, that they are part of the team that in the end is also in charge of the publication. So if it might either get passed back or it is approved, and then it moves on to the contract. As said, we have the standard contract, and if your legal department is easygoing on it, it is actually pretty fast. So it's just between application and data transfer. It is possible to have it within a few weeks, but depending on the complications here, sometimes it may also take very, very long. Then you get the data. You will get it physically, so at some point, I guess it's going to change, but still it's this way. You will get encrypted data and that are really tailored for this purpose. And behind all this is, again, the possibility to, there are automatisms basically behind everything that we do here. So it gets passed on to the data management. They see which variables have been applied for. They run their scripts, and you just get things tailored to what you have been applied for. So you have it for a certain time, and afterwards you need to delete the data again, but you can store it with us. Because at some point in the future, it might be needed for any revision or whatever. So this is kind of an overview on how this is working. And this is also the brief overview on the transfer side. If there are any questions, you can simply contact Christian Blanke, and he then will reply or pass it on to others who can do so. So I hope this was a helpful overview on our transfer side, and any questions, welcome.
Thank you again, Carsten, for your contribution. And with that, I think we have to move on.
Okay.
Perhaps I have
Thank you.
one comment on this last question. So I think these cohort studies are used for primary. The primary use is research, which is quite different from care data. There, the primary use is different, and therefore that might be the difference between data coming from the medical area and data coming from epidemiological studies.
Yeah, thanks for this add-on, Juliane. That's quite right, because broad consent is normally used in terms of data coming from patients, but we don't have patients. We have a study, and this is legally something entirely different, and therefore it's quite important to remark on that. Thanks.
Thanks for the clarification. And now we move on to the BIPS application process, and I'll hand over to Tim.
Yeah, thank you very much. Thank you very much for the invitation to present the BIPS Research Data Portal today in the series of the NFDI4Health Meet-the-Data Gesundheitsforschung. First of all, I would like to... now it works. I would like to give you a short introduction into BIPS, what we are. So the long title for BIPS is Leibniz Institute for Prevention Research and Epidemiology, BIPS, and our motto is health research in the service of the people. It was founded more than 40 years ago, and since more than 10 years, we are a full member of the Leibniz Association. We are covering the entire cycle of epidemiological research, including the development of strategies for prevention, and we are investigating factors influencing health, like lifestyle, environmental factors, biological factors, social factors, and also drug safety. Yeah, our data is very diverse and with a wide range of different study data, and we decided to make it available and findable using the NFDI4Health Study Hub. So if you go to the NFDI4Health Study Hub, you will find a BIPS collection. Now we have there more than 200 different resources on this Study Hub. They are findable. That includes studies, but also study instruments. So very detailed information about the questionnaires, for example. But what is maybe most important, also dictionaries, so that you know what data we have available. One of our maybe most attractive resources for reuse is the EDIFIX family cohort study for research on children and adolescents' health. If you search for the study, for example, with the terms European Study Childhood Health, you will find it in the Study Hub. So you will find the family study, and you will also find the EDIFIX study. For both studies together form the EDIFIX family cohort. For these resources, we have rich metadata included. For example, all data dictionaries, which are much more than 10,000 variables, and we have annotated similar to what Carsten presented before using the Maelstrom taxonomy. In more detail, what is the EDIFIX family cohort data? It's a huge cohort study with the aim to enhance knowledge of health effects of changing diet and altered social environment and lifestyle, to contribute to reduce the burden of nutrition-related diseases. We have more than 30,000 individuals in our dataset, not only children and adolescents, but also information about their parents. They're coming from 9 European countries. And we have them really deeply phenotyped. So as mentioned before, more than 10,000 variables from different health aspects like diet, physical activity, well-being, psychological factors, lab biomarkers, environmental factors, family structure, and genetical information. And what makes this study so valuable is a longitudinal character. So we have a lot of children and adolescents with measurements in multiple waves. So if you're interested in applying for the EDFIX family data, you can apply using our recently established research data portal. And here you see the general process, starting with search and exploration. So you can use a study hub for exploring the BIPS collection or the EDFIX family data. And we also published an EDFIX family dashboard. I will come to that in a minute. Then you can register and fill a form and provide a data application. With the whole process, you can get support from our data transfer point. And if you receive approval from our study-specific access committee, you can really access the data and do what you actually want to do and do the research using different access options. So that was just a general overview. I will go through the different steps now in more detail. So first of all, the dashboard. As a dashboard, or the purpose of the dashboard is to analyze the research data before you get actually real data access. You have to register shortly, and then you can use a tool which is based on synthetic data only. It's also protected using Data Shield, and it's more or less in a normal R-Shiny application for you as a user. With this tool, you can check if the EDFIX family data is suitable for your research question, and we can go through a use case in the next slides. A use case where an external scientist would like to investigate the association between physical activity and well-being in European preschoolers. This is one part of the dashboard. Here you can analyze the data, and you can derive summary statistics, you can derive bar plots, box plots, or alluvial plots. For our use case now, I have selected the feature physical activity. And I have done that for different age groups, and I selected the summary statistic as a sample size. And what you see here now is that we have data from physical activity in the baseline examination from more than 7,000 children. In the next step, if you would like to check if the distribution of physical activity is as you would expect that, you can again select the feature physical activity, select the study populations here, age group again, and then for the bar plot, you see different histograms here, so you can check if the distribution of physical activity is as you would expect and if it is useful for your research purpose. In the third step, then you can go even deeper and check box plots. Here in this case for the groups of education levels and well-being categories, again for physical activity level. And what you see here, for example, for the well-being categories at baseline, which is the lowest baseline category, you see that there is a difference in physical activity for the different education levels. Yeah, so you maybe think, oh, okay, I should include education as confounder in my analysis. And in the last step, you also could check using this tool if you maybe could do a longitudinal analysis here using this alluvial plot. And what you see here is for one variable of interest, in this case, well-being categories, you can see the frequencies or the transition over time from baseline to the fifth follow-up. Here, for example, for the highest well-being score, you see at the beginning is a percentage quite high, and then it becomes lower and lower with time, unfortunately. Yeah, and when you then have decided that the data is suitable for your research question, you can actually apply for data. And if you need some support or have questions, you can ask our data transfer point with Claudia Brings-Kuppe and Svenja Böckhoff. They serve as a central communication service. They accompany the entire data access process. They can refer you to study specialists. And if there's any question before, during, or after application, the data transfer point will support you. And then the actual submission process of this application will be done by an online application form, which is at the moment in development, but it will be online soon. For this purpose, we use the ProSkyve software developed by the Miracom consortium of the Medical Informatics Initiatives. And with this tool, you can see all steps from proposal to data access transparent as an external applicant. When the proposal is submitted, it is forwarded to a study-specific data access committee, and they will decide on data access. For example, in the case of the Idefixer family cohort study, it's an international steering committee of the study. After that, a data use agreement will be signed, and our data management team will prepare the analysis data sets. And as Carsten mentioned, we also tailor it to the specific research question. So we would only include required variables and only for the selected analysis population. For data access, there are actually several different ways how that can be done. That depends on the research question and the data required. So what we have here at our institute is a research data center that can be used for on-site analysis. So we have an office here for guest scientists, and that's used for particularly sensitive data. As a second option, we have a trusted research environment where you can access a server via a VPN. That's a standard use case for analyzing research data. We also use that for internal purpose for the Idefixer family data. And I guess that will be the normal case for external data access too. Another option is a data shield. The idea behind data shield, it's often mentioned in the context of federal analysis, but you also can use it for sharing data in the single site version. The idea behind it is to take the analysis to the data, not the data to the analysis. And then you can analyze the data, and similar to R, you can analyze individual level data, but without seeing the individual level data. Yeah, and as a last option, we also offered physical data provision, but only for aggregated data, for example, for meta-analysis or for data provision of pseudonymized or anonymous data of very reduced extent. Yeah, that was the overall procedure. As a discussion, I would stress that a whole team is involved. I'm very glad that I see some on the screen. I've seen Claudia, Achim, Rebecca, and Svenja. They're all involved, and yeah, it's a lot of work. So we need the expertise of computer scientists, data manager, data scientists, and epidemiologists for our work. Yeah, and I have to stress again, we are still in this transition phase. For example, for the Idefixer family cohort, we also have a similar cohort profile paper, as Carsten mentioned before, for their study. We have a similar publication for the Idefixer family cohort. And there it's described for data access, please approach the study principal investigator via email. That still works, but we hope we can stepwise shift over to our maybe more professional system. And since we are in a transition phase, we will continuously evaluate our processes and improve them. For example, the online application form is tested at the moment intensively and will go online soon. In the near future, more and more BIPS study data will be findable and deeply searchable with NFDI4Health Study Hub. And we will try to even better integrate both services or both infrastructures so that we have much more links between the BIPS resources in the Study Hub and the BIPS Research Data Portal. Yeah, that's it. Thank you very much for your attention. And now we are open for discussion, and I'm very glad that the technical experts from my colleagues are here too. Yeah, thank you very much.
Questions to Tim or his team? Okay, before I hand over to Juliane, I would like to briefly sum up the first edition of Meet the Data, which comes to an end with today's session. So over the past 6 months, we got insight into the application process and use of datasets from various studies and data holding organizations, including the BILOF study of the Charité or the Research Data Center of the Robert Koch Institute, cancer registries, and also the Forschungsdatenportal für Gesundheit. And today, key studies of NFDI4Health partners. If you have missed some of the sessions, or recordings are available on our YouTube channel. I will post the link in the chat. And the strong interest of the series, we had almost 400 registrations overall, underlines, I think, the relevance of the topic. And however, this also highlights the challenges researchers face in kind of navigating a complex and fragmented landscape in Germany. And as we have seen here, there are many similarities in the application processes across all the data sets presented, but also each has its own specific requirements. And from the perspective of a researcher who's interested in the secondary use of data, you must invest considerable effort in understanding the details of each process. And this is where the vision of NFDI4Health comes in, as a key focus is to standardize and centralize the data request process, and with that simplify access. And with that, I would like to hand over to Juliane, who will now present these goals in more detail.
Thank you very much. So I will share my screen. Do you see my screen now in the presentation mode?
Yeah, we see it.
Okay, I have to move slide here. Okay, I would like to use this opportunity to give you a brief summary again about the National Research Data Infrastructure of Personal Health Data. First of all, what's our mission again? So the mission for us is to increase the value of research in the area of epidemiology, of public health, and clinical trial-based research by making all this high-quality data, what we have seen now, the variants today, to make that international findable and accessible according to FAIR principles. And if you look for the data, what you have already seen in these two examples is that we have, especially for the epidemiological studies, we have really deep phenotypes, high variability, and also molecular and genetic profiling, biobanking. We also want to provide access to public health studies and clinical studies, and at least for overviews and central access, also data of disease registries or from large administrative health databases. In our consortia, which is you can find in whole Germany, we have the main epidemiological and public health studies, 27 here in this depiction, and also for the clinical trials, we have the clinical trial centers as participant and partners in NFDI4Health. But as you all know, we have a quite heterogeneous landscape in German health research data. We have on the one hand side, we are as NFDI4Health part of the NFDI, but there are also other research data infrastructures in the NFDI focusing on at least biomedical data. For example, there's GHGA focusing on genomics data, and the Human Genome Project they are also involved. But we have for the biomedical research also consortia such as NFDI for Immuno, NFDI for Microbiota, and NFDI for Bioimage. In addition, we have also the different research data infrastructure focusing on healthcare data, which is the Medical Informatics Initiative and also the Network University Medicine. We have the health registry data. One example is the German Center of Cancer Registry data, and we have health insurance data. In addition to that, we also have many research-related infrastructure, such as the German Center for Health Research, Helmholtz Health, or Fraunhofer Health. And the point is that we really closely collaborate with these different infrastructure to set up the German infrastructure of health data also within the European health data space. And I would like to show you what key infrastructure elements we provide in NFDI4Health. So if you're looking for the data holding organization, which we have seen before, now two of these with BIPS and University of Greifswald with SHIP, we have different data holding organization, and sensitive data is not openly available. But on the other hand side, you can share information about the data, and you have seen some of that. And here we try to establish common infrastructures and common workflows that local data hubs are connected to our NFDI4Health study data to allow to publish research data. That does not mean to publish the sensitive data, but only the public data, and that we can do with directly with a local data hub, which is provided by NFDI4Health, but we can also interface with infrastructures which are already there. And as you also already have heard, we don't want to have only the description of the study, but we would like to have additional information such as data dictionaries, so that we can in the future enable the researcher also to select the variables which they want to use. And you have seen some of the examples which how it is done locally on the different data holding organizations. But what we are currently working on, that's not ready yet. These two infrastructure elements are already there. That's to extend the German portal for medical research data, which has been developed by the Medical Informatics Initiative, that we can apply with the FDPG also for study data from the different studies, and that this whole process is organized centrally. So at the end, the data holding organizations are responsible for the data, but the process is organized through central portal. So that's the aim we are working for in this and also the next phase. When we are looking for data analysis in NFDI4Health in the current phase, we mainly support in infrastructures for distributed data analysis, or which is called nowadays also data visiting, so that you don't get access to the data, but can use the different data sources via distributed data analysis. In the second phase, we will also provide access to secure processing environments. So I would like to summarize, because I have not more time for that, some of our achievements from the first phase. As I've shown you with the core infrastructure elements, we have established the publication workflow for sensitive health data, which is already accepted by major German health data infrastructure. So we are quite comprehensive in terms of findability. It provides also blueprint for the central service, which has to be developed for the European health data space. And for that, we have also established a consolidated metadata schema, which is also which accounted for international standards and is consolidated with European initiatives. And currently we try to consolidate that in the upcoming metadata catalog for the European health data space. We are currently working for the first extension of the German portal for medical research data. That's at least one data source is already connected. But yeah, you can understand that it will take a while that we put all these different sources together and get that all established for this for central access, and that we will be working on further in the second phase. But nevertheless, we have already established a collaborative network between the different infrastructures, that we share standards and architecture components, and we also collaborate on processes for findability and accessibility, which is a major focus of NFDI4Health. Another focus is also to improve record linkage, because we are clearly in need for that. We have published a white paper there. Partly, small part is already considered in the German Health Data Use Act, record linkage between the data of the insurance data and the disease registries, but we need for sure more opportunities for record linkage. We have also enabled the data holding organization to share the data via secure processing environment, but also to share it in the privacy preserving manners. So by making complex laws comprehensible and applicable, provide advice and tools for synthesization, anonymization, or re-identification risk assessment, setting up routines for assessing quality and for harmonizing cohort data. And we have a number of comprehensive training courses. And if you are interested, you can also contact us. And one example is the graduate training program, Data Train, which is provided by the University of Bremen. So a short look ahead to the second phase, which will start in October, hopefully start in October this year. On the one hand side, we would like to enhance our user community involvement further. So we are setting up currently help desk, where we enlarge our consulting service. We provide a toolbox for the different services we have there and tools. And we will provide a lot of training, education, connect further with the professional societies, and organize workshop and conferences. So if you're interested to get a deep down training and ask questions, please contact us directly. We also will consolidate and extend our standards, softwares and services. For example, increase usage and user experience, as I have said before, work on further on the central access, but also on the standards for interoperability for international health infrastructures. We work on data analysis use cases within different infrastructure and also within Europe on harmonization, data quality, and further statistical workflow analysis. In the area of use cases, we build on our service and standards, and we'll try to involve our user communities further, exchange also with other NFDI consortia, especially in terms of data from genomic data and cohort data, how that will be worked out and work together. But also networking with other national and international initiatives. And we have started NFDI4Health as a COVID-19 use case, and that will be also supported further. Our aim there is to cover the whole health cycle from prediction, prevention, screening, and etiology to treatment. I would also highlight as last, almost last slide, that we not work alone in the NFDI. So that's another purpose, not only to link the data within the health domain, but also link the data or being able to use data from the health domain, but also from other domains. And therefore, the National Research Data Infrastructure currently has 26 consortia, more than 570 participating organizations, and it covers all 4 domains: the life sciences, the natural sciences, engineering sciences, as well as humanities and social sciences. And we also have, similar to the medical informatics group, we have overarching working groups, or that's so-called sections. And we have an additionally consortium which is called BASE for NFDI, which will provide over time basic services not only for the NFDI, but also which can be used in the whole research data environment. And with that, I would like to close my very brief overview and thank you all with the participants of NFDI4Health from our last consortium meeting and the different institutes which are partners in NFDI4Health. And if you're interested and don't know the Central Health Study Hub, please look at it and look at our resources. Thanks.